Anthony Hurd, Hull and East Yorkshire Smile Foundation, going to talk to us about the Humber Coast and the Vale Green Social Prescribing Programme. Welcome, Anthony. Over to you. Thank you.
Excellent. Thanks, Paul. I'm just sharing my screen, so hopefully everyone can see that.
Yeah, it's not in presentation mode yet, but yeah.
There we go, brilliant.
Yep,
so yeah, I'm here to talk to you about the Humber Coast and Vale Green Social Prescribing Programme. So it's great to hear Craig at the beginning there talking about the importance of nature for health and well-being. A bit of sort of operational overview. So the programme sits within Hull and East Yorkshire Smile Foundation, and in particular the Smile Health team. And myself, I'm full-time programme manager. So my background is nature conservation, working to connect people with the outdoors. But I am supported by our clinical lead, Dr. Hannah Armitt, who works 1.5 days a week on the programme and is a clinical psychologist from Humber Teaching NHS Foundation Trust. So in her day job, she works in R&D with a particular focus on mental health and outdoor space. In terms of kind of a national and local context to the programme, we are one of 7 test and learn sites across England who are all looking at how to embed green social prescribing into communities in order to improve mental health outcomes, reduce health inequalities, reduce demand on health and social care systems, but also to look at developing best practice in making green social activities more resilient and accessible. So the programme, as I said, is being delivered by Hull and East Yorkshire Smile Foundation, and we're doing so on behalf of the Humber Coast and Vale Health and Care Partnership, and this covers the 6 kind of defined places of North East Lincolnshire, North Lincolnshire, Hull, East Yorkshire, the Vale of York and North Yorkshire. So that's kind of my geographical footprint for the programme, and we're overseen by a steering group of 10 individuals who represent public health, so through East Riding Council, mental health through Hull and East Yorkshire Mind and Navigo, nature through Yorkshire Wildlife Trust, active through Active Humber, social prescribing through York CVS, and some others. So in terms of sort of what is green social prescribing, there's no formal definition. We do have a national team who are looking at formulating one. It's open to a lot of debate, so we don't have that yet. But from a Humber Coast and Vale point of view, we define green social prescribing as linking people to nature-based and outdoor activities, and this does include both our green and blue environments. So activities that can make up green social prescribing can vary widely, can include exercising outdoors through walking groups, being more active in your travel by cycling, community gardening and food growing projects, alongside supporting conservation through practical habitat management works. But other activities might utilise the outdoors and nature in both arts and cultural activities. And the Nature and Prescription Handbook, which was put together by the University of Exeter and released earlier this year, has kind of defined categories for green social prescribing. So you can see in there conservation, sort of wilderness focus, so bushcraft and survival, horticulture and gardening, care farming, sort of exercise and sport, the creativity focused, but also things like nature appreciation through different citizen science schemes, and more therapy-based activities that occur in the outdoors and nature. Here in Humber Coast and Vale, we do have lots going on already that tick a lot of those boxes. So Valkyrie wilderness workshops, kind of utilising bushcraft and things like that, practical habitat management, improving access to green space, walking and cycling groups, and lots of horticulture going on as well. We've also got an amazing natural environment on our footprint. And I put this slide together a long time ago when I first started on the project, but have subconsciously put 2 pictures of the Humber Inn, one from each side, Hessel Foreshore there and Blacktoft Sands as well. But yeah, just to highlight the range of natural environments that we have to engage people with. So in terms of why now and why the programme has got this funding across England at this time, COVID-19. You know, as Craig said, it's had a huge impact on people's health and well-being. but highlighted that importance of being outdoors. It has also highlighted the inequality of access to green space. Not everybody was able to access green space during lockdown. But, you know, more broadly, there's consistent evidence that engagement with and spending time in green and blue spaces is beneficial. So in terms of physical activity levels, increases in mental well-being, reducing stress, but also developing that positive affinity with nature and building nature connectedness. Social prescribing and community-based support is also part of the NHS's long-term plan as they commit to more personalised care. And there's just sort of, you know, there's lots of evidence and reports out there. So there's just a few there to look out for from Natural England, University of Exeter, the King's Fund, but lots more from wildlife trusts out there as well. In terms of what we're doing on the ground, so our programme runs until March 2023. A lot of what we've done at the moment is scoping. So what is going on at the moment? So we've been looking at sort of green social prescribing providers and identified over 350 groups and activities across Humber, Coast and Vale who are doing some kind of green social prescribing, be that active or be that nature-based. We've spoken to over 80 of them to try and understand who they work with and what activities they do, what current links to healthcare systems they have, and if they do have referral routes into their activity, whether they monitor impact and how they're funded. We've also been working with our social prescribing networks to understand how they work in each of our 6 defined places, and if they are currently referring into green organisations. The picture is very mixed across Humber, Coast and Vale. So some social prescribing is run by the voluntary community and social enterprise sector, whilst other areas it's direct through the NHS or it could be local authority. And we've also been talking to our mental health services as well to see how green social prescribing can link in to their activities. Another thing we're doing is we want to evaluate green social prescribing. So there is a need to gather outcome data to show how effective green social prescribing is and to provide that confidence to healthcare commissioners and other stakeholders that it is a safe, effective and viable option and can support those currently accessing services, but also acts as a preventative and you know, within communities can actually support people who may be at risk of coming into contact with services, but through green social prescribing don't ever do so. So we'll be following 40 individuals with mild to moderate mental health in each of our 6 places as they access a green social prescribing activity through our social prescribing services. So our first phase of data collection will be November 21 till March 2022. And we will be taking 2 outcome measures. So HADS looks at anxiety and depression, and ONS4 is a general wellbeing measure. But we'll also try and understand who the people are accessing these services. So as that test and learn site, we want to understand what works for whom, in what circumstances and why. So how many people benefit from green social prescribing, who they are, what activities they engage in, whether the outcomes, what they tell us about how effective it is, and also what is the best way to deliver green social prescribing and look at barriers and ways to overcome them. We're also wanting to support the voluntary community and social enterprise sector. So we aligned £200,000 of NHS charities together funding to the programme early on. And we've just launched a second round of grants and we're wanting to fund programmes, projects and organisations that improve people's mental and physical well-being through activities that occur outdoors and in nature. So there's £150,000 available and we've split it into 3 pots to ensure that different levels of organisation have equal access to that money. So kind of in summary and overall, we aim to support our mental health and social prescribing services by working with those existing networks to ensure easy access to community interventions and also collate and gather that data on the individual impacts of green social prescribing, but also how it impacts the wider system. We aim to support our voluntary community and social enterprise sector by ensuring green social prescribing is sustainable. So we want to grow our own So using that grant funding to support those leading initiatives to thrive, but also share best practice to nurture new interventions, and also facilitate those links between green organisations, blue organisations with social prescribing and other healthcare services. And ultimately, we want to support those in need of mental health support by embedding green social prescribing into our healthcare system across Humber Coast and Vale, and supporting and championing a diverse range of interventions that people can get involved in. We're just moving from phase 1 to phase 2 of the programme. So we've done a lot of the scoping. We're now moving into the cohort work and having that grant funding go out. And then phase 3 will be taking all the learning and all the data that we produce to build confidence in green social prescribing and push it through the Humber Coast and Vale Health and Care Partnership, with the hope that investment comes from different and new sources to support the community sector who are running these activities. If you do want to find out more, we do have a newsletter, so I can drop these links into the chat. And I guess from my point of view, we've only got a short amount of time for this project. So we're really interested to hear from all sectors as to, you know, are you currently linked with green social prescribing? What demand is there for people to get involved with outdoor activities? Do you have any good case studies? And what can a programme like ours do to support more referrals into green social prescribing? So I'll leave it there and stop sharing my screen.
Thank you very much, Anthony. That gives a whole different dimension to some of the things we've been talking about earlier, and some really exciting approaches. And as you say, connecting people and nature, really such a valuable and important thing after some pretty awful couple of years, isn't it? So thank you, Anthony.
Thank you.